a restorative demo on Manny, and we're going to be doing a 4-6 MO amalgam. We're going to be doing a 4-4 DO composite with a Garrison matrice, and we're going to be doing a 4-2 mesial buckle with a mylar and a wedge. So I brought the patient in, I've seated them, I have checked over their medical history. Before the doctor comes in, I'm going to take a shade because we're going to be doing an anterior composite restoration. So what happens is when the patient stays open and we have a dental dam on, it does desiccate the teeth, which creates, they look a lot brighter. So Manny's got very bright teeth. I've picked a shade and I can put this aside. I have called my doctor in, and now my doctor is going to come in and we're going to start with anesthetic. So we'll assist for the anesthetic. Okay, place that 1 to 2 minutes. I'm not going to rinse because we don't want to wash away the anesthetic. When I am passing the anesthetic, I have my prick guard on and I'm placing it in my dentist's hands and I'm removing. And I'm going to give you a cotton roll, and then what you can do is you can actually inject some anesthetic in there. So she's doing her IA, good. And then when I'm retrieving the needle, I have got the needle ready, my hands and fingers are out of the way, and I can take the anesthetic back. And I'm going to give my patient a full mouth rinse to get rid of that nasty taste. Good, okay. I'm going to jump over and I'm going to place our dental dam. Okay. I've done my little poke test with my patient. I can't have light, can I? Okay, so I'm going to just quickly place my dam. So one thing when you're placing a dam with your patients, make sure you have everything that you need close at hand. Technically, you don't want to leave your patient, like not removing your fingers out of the patient's mouth. You don't want to kind of abandon them with a dental dam or, you know, leave them sort of secluded with just a clamp on, okay?
There we go.
And we're going to give Amir and Explore so they can double check everything. Because I'm done with the anesthetic, I'm going to put the anesthetic in the back. There, okay? All right, and now we're ready to prep our teeth. Just revise our prep. Okay. Good.
So because she's not using indirect vision, I don't have to worry about clearing the mirror out. Okay, good. And now she's going to go in with a slow speed to get the residual decay. And because the slow speed doesn't have any water, I'm going to let her drill for a little bit, get the decay out, and then I'm going to give the teeth a rinse. I'm going to start with some air and then some water to clean out the prep. Okay? Good. And I'm going to clean it out again. And because we're doing that amalgam, I'm going to pass the spoon excavator to see if there's any residual decay. Good. And what I will do is I will pass you the mesial margin trimmer.
Please.
Okay.
Thank you.
There we go. And then I'm going to pass her the distal margin trimmer for the 4-4 DO. And all this is doing is it's just defining those margins. Good. Okay. And I'm going to give it a rinse. And now, are you happy with those preps, doctor?
Yes, I'll check with the Explorer here.
Okay.
Yes,
Perfect.
margins look
Perfect.
perfect.
Okay.
Yeah, very happy.
So what I'm going to do now is I'm going to place my, because we're going to do the amalgam first,
And I'm going to place the Toffelmeyer and the wedge. So when I place my Toffelmeyer, I have my Toffelmeyer set up for the lower right-hand side. So if you need help practice setting up the Toffelmeyers, make sure that the narrow side is towards the gums, the gingiva. The guideposts are also towards the gingiva. I'm going to place it around. I'm going to make sure it's big enough. I'm going to place it around the tooth. I'm just going to hug the tooth. Okay. And this is a very small, oh, there we go. Slide it over, and I'm going to tighten it on the tooth. Just like that. Okay. When I place the wedge is going to be placed from the lingual. I'm going to take the wedge, and what the wedge does, it's our little, forms the contour of that embrasure space. It's going to hug the matrice up against the tooth and create that wall, the mesial portion of the wall, and that wedge is just a little bit too big. I'm going to put a smaller wedge in. There we go. Okay. Use the back of my cotton pliers. Okay. And now in order to complete forming the mesial aspect of that restoration for the filling, I'm going to take my burnisher and I'm just going to push it up against the distal of the 5. Okay, and that's going to create our contact. All right. Okay, so there's our matrice, our Toffelmeyer, and our wedge placement for the 4-6 MO. So our doctor's going to check the Toffelmeyer and the matrix, and she's going to give me the go-ahead for the amalgam. So what you're going to have,
spill, please.
One spill. She wants 1 spill. So what you're going to have for the amalgam is you're going to have the amalgam well, the amalgam carrier, and 1 spill of amalgam. There we go. So your carpula is going to look like this. So when you have your amalgam, this has to be pushed down. In this little capsule, there's actually a little membrane in there. And when you push down on the membrane, it's going to mix the liquid, which is the mercury, and the alloy. And you're going to put it in the amalgamator. It's preset to 10 seconds. And we're going to triturate it for 10 seconds. Okay, and when we go to open this, you're going to notice like that little membrane. Sometimes it comes out, that one's not coming out. And then you're going to have a little ball of amalgam. Okay, this can be thrown away. And with that little ball of amalgam, I'm going to take my amalgam carrier and I'm going to keep it on the counter. And I'm just going to press to the bottom of the well, and what that's going to do is going to condense the amalgam into our carrier. And I'm going to transfer that over to my operator, and I will have a condenser ready for my operator. There we go. And they're going to condense it into the cavity prep. As she's doing that, I'm condensing a little bit more into my carrier, but I'm also watching to see how much material she has and how much she needs. And this is where you're very welcome to communicate with your operator and ask, how are you doing there?
Good, I just need a little bit more.
A little bit more?
Yeah.
Okay. And I wipe off my instrument, make sure that there's no residual amalgam on the carrier, on the condenser.
Good there.
That's good? Okay. So I started loading the carrier again, but we don't need that. I need to get rid of what's in the carrier because if any amalgam is left in there, it will harden and then we have to drill it out. So I make sure that's cleaned up and I'm going to set that aside. And in order for her to finish it, I'm going to pass her a burnisher. Okay, so she's going to burnish it a little bit and then she's going to want to start to carve it. And you can pass either a Hollenbach or a Cleoid, and I'm going to ask my operator what the preference is. What would you like?
I'm going to have a discoid clear.
Discoid, okay. So she's going to just start carving it right before it starts to set. And then would you like an explorer?
Yes, please. Yeah. I'm going to remove the Toffelmeyer from the mesial of the prep there.
Okay. So she's using the explorer to go along the mesial margin just to remove any residual amalgam. And she wants to start removing the Toffelmeyer. So she's going to take the wedge out first. Take the Toffelmeyer off. And then she's going to use the condenser to hold the filling in while she's removing the band. She's going to remove the distal first and then remove the mesial because we don't want that filling to pop out. Okay, I'll take that and I'll give you the mirror back. And would you like a carver or the explorer?
A carver, please. Yeah.
Good guess. Okay, so now she's going to start carving a little bit of anatomy in there. And with the amalgam, because it takes about 24 to 48 hours for the amalgam to set up, when she starts carving, it's still easy to carve into the amalgam. And she can start carving a little bit of anatomy, some of those developmental grooves, and make it look nice, make it look toothy. Okay, so she'll do the initial carving. I'm going to suction and rinse the residual amalgam away. Okay, and we're going to let that set up. So with the residual amalgam that we have left in our well, where did I put it? Right in our well here. I have a Mercon container that I'm going to be disposing of this in the Mercon container, and you will find a Mercon container in each operatory. Okay, so we'll pull those out. Oh, and it's right there. So one thing I want to say about the Mercon container, do it at the end of the appointment because when you take the lid off, it has a really quite a strong odor, and quickly dump it in and put the lid on right away. And now I'm going to pop over and we're going to prep the 4,4-DO. So before I put the Garrison matrice on, I'm going to place a liner on the 4,4-DO. So we're going to be putting our liner on before our matrice. And we're going to be using the Vitrabond as our product here today. And we're going to use 1 to 1. 1 scoop. And when you're doing your evaluation, we can use the Vitrabond, or we will have a product called Limelight, which is looks like this, and it's in a syringe. Okay, so there's no mixing involved with this product.
How many drops of liquid?
It's 1 to 1. So I have 1 drop of powder, 1 drop of liquid, and we're going to mix it into that nice luting consistency. Okay. And I'm going to clean my spatula off right away. And I'm going to place the liner on the 4,4-DO just along the pulpal floor. I'm going to make sure it's nice and dry. I'm not putting it up on the walls. I'm just putting a drop of it. I'm just gathering a little bit up on my applicator, and I'm just going to put a little drop of it on the pulpal floor because that's where the pulp horns are, and that's where we want that fluoride release and we want the protection. So once I've placed that, this is a light cure. I'm going to get my light, and we're going to cure it for about 15 to 20 seconds. Okay, so you will notice that I'm just kind of covering it with my finger. Each operatory has a shield, so you can use the shield over top. Okay. So as soon as that's done, I'm going to have a quick look and make sure that there's not too much there. That's perfect. Now I'm going to start placing my Garrison wedge and matrice. So you're going to have these little bean-like, they call them little beans, little matrices. So when I place it, the smile is towards the occlusal surface. And what I'm doing is I am reforming that wall, that distal wall that's missing on the 4-4. You can use your finger, you can use a cotton plier. I'm going to hold it in, and I'm going to get a wedge, and I'm going to put it in from the buckle or the lingual. This wedge might be too big. I'm going to use my best pair of forceps, which are my fingers. And that wedge is far too large. So I'm going to see if I can find another wedge. And there we go. Got it. I'm going to get a nice orange wedge. So if you're not sure of the size of wedge that you need, put a variety out, and that'll eliminate you going in and out of the drawers. Just like that. So that wedge is wedging in our little matrice there. And with the Garrison band, you'll notice that it has, can you see, it has like a little V in the band. So I'm going to place the band towards the distal because I've got enough room there. And as I place it over, what I'm doing is that I'm hugging the band towards the distal of the tooth, and the wedge is going in that little V. And I'm pushing everything down for it to hold together, just like that. Okay? So I want that matrice to support the wall that's missing there. How are we doing for visual? Is that okay? There we go. Okay. I'm going to get my burnisher, and I'm going to burnish it to create the contact between the distal of the 4 and the mesial of the 5. Okay, so when I'm looking down on it, I'm seeing that it's actually, the band is going right down towards the gingiva. There's no dam caught in there, there's no gingiva caught in there, and we can maintain the isolation, and it'll stay nice and dry because our composite material is very moisture sensitive. All right, so that's our Garrison. And I'm also going to place my Mylar at the same. So when I place my Mylar, I'm going to place it on, of course, the wall that's missing. I can actually encircle the whole tooth with it, just like this, to stabilize it. But I'm just going to do it from one side. And then I'm going to put the wedge on the buckle there. Okay? And I'm wedging the Mylar right into the rest, right into the prep there, okay? And it's going to stabilize the Mylar. The wedge is going to stabilize the Mylar strip, okay? Just like that. That's nice and tight. Okay, so now that I've got my Garrison, I have my Mylar and my wedge. Now I can start with my etch. So this is another licensed duty, delegated duty that you can do. So for the 4-4-DO, what I'm going to do is I'm going to do a dent and etch. So doing a dent and etch, I'm going to etch the enamel first because the enamel takes longer to etch, and this is coming out really, really runny. So I'm going to let that sit there for about 15 seconds. And then what I'm going to do is I'm going to backfill on the dentin. Because the dentin is a much more porous structure, it doesn't need to be etched as long, okay? And I'm going to come around and I'm going to just do an enamel etch on my anterior, and I'm just going to go around just like that, okay? And then I can go back in and I can do my dentin etch. There we go. Okay, so I'm etching these both at the same time. So time lapse, we've let the etch sit on the dentin for 30 seconds, yes. So when I'm rinsing off etch, I'm putting the suction, this is your limited rinse, I'm putting the suction right over. I'm only doing water because I don't want that etch sprayed all over. And I'm going to do a nice light air dry. And I'm going to put my suction right over, suck up the etch, and then I'm just doing water. Yes. So once I know all the etch is gone, I'm just going to do a nice light air dry. We don't want to desiccate the teeth. There we go. I want to show you in your operatories, you're going to have a two-step, you're going to have a primer and a bond, and then you're going to have a one-step. And the one-step is primer with the bond, okay? But you're also going to see these little, what they call lollipops. And the lollipops are self-etching, and they have, or sorry, self-etching primer, but they have the primer and the bond in them as well. And they come with their own little micro brush. So if you see these, what you can do is you can actually just poke through and penetrate them together and give it a stir. And then when you take it out, you have the primer and the bond all in one. So this is its own form of a delivery system for a one-step. And you will see that in some of the operatories, okay? So you'll see this is a one-step, you'll see the bottle as a one-step, and then you'll see the separate prime and bond in a two-step, okay?
Why do some dentists use one step compared to two steps?
Operator preference.
Okay.
Operator preference. So for the 4-4, I'm going to do a two-step. I'm going to dispense my primer, one drop, just like that. Now, with your primer and your bond, these are placebo, all right? So there's no glue or adhering qualities to them, so your restoration probably won't stick. The only reason why it would stick is because we are using real etch, okay? So I have one drop of primer and one drop of bond. Now, because the bond is light cured, I'm going to put my little black bottle over it, and I'm going to get my bend-a-brush. And the bend-a-brush is just that. You can actually bend the tip of it. So for the 4-4, I'm going to apply my primer. And the primer is our re-wetting agent. Okay, so I'm going to scrub my primer right into the tubules there. Sometimes you might notice some operators, they do a couple coats of it. And then what I'm going to do is, I'm just going to do a light air dry. And that's going to drive it down into the tubules. Okay? And with the same brush, what you can do is go into the bond. Now the bond is much thicker and it has more of an odor. It smells like glue because this is where we get the adhesion for our composite filling materials. And I'm going to apply my bond. And now because the bond is so much thicker, it has a tendency to pool in the restoration. So once I apply my bond, I'm going to do a light air dry. And that's only to disperse the material. Okay, and then I'm going to get my light. And I'm going to cure it for 20 to 30 seconds. Okay? If you go into an office and you see these products, you can always go to the manufacturer's instructions and see what the curing times are for, like what they're designated for. Okay? Okay, so that one is etched, primed, and bonded. Now for the anterior filling, I'm going to use the one-step prime and bond. Okay, and now this one, because it's all in one step, I'm just going to put one drop. I'm going to get a new little bend-a-brush. I'm going to bend it. Okay, and coat my brush. Make sure that this is dry. And I'm just doing one step. So I'm just coating my prep, just like that. Prime and bond, all together in one, in harmony. And I'm going to dry it. So when I'm drying this product, I'm doing the same thing as I did with the two-step. I'm driving this down into the tubules, plus I'm also dispersing the bonding feature of this product. Okay, and then I'm going to cure. Okay, so there is definitely a difference between the one-step and the two-step. With the two-step, you do not cure the primer because it's just a re-wetting. With the one-step, you're curing right away. Okay. All right, so now my preps are both done. Etched, prime, bonded. I'm going to go get Dr. Wilson and let her know that we are ready for our fillings. Okay, so I'll let you have a look. going to, so this is for the 4-4. I'm going to give you a little bit of flowable. So I've handed Dr. Wilson a little bit of flowable, and the flowable is going to go in the 4-4, and it's going to fill in the proximal box. So it's just that little space that sometimes our harder, more condensable composites can't get into. So she's going to apply that, and then we're going to go straight to composite, and I'm going to pass her the plastic filling instrument. I'm going to have a gauze ready in case there's any residue. How are you doing there?
Oh, that's perfect. Thank you.
Okay. So as she's condensing it, do you need any more, or we're going to layer it?
I think we'll layer.
We'll
Maybe,
layer?
maybe one more layer here.
Would you like me to cure right away?
Yes,
Or?
please.
Okay, so I'm going to cure it, and I would grab my shield. And so Dr. Wilson's going to do another layer. Okay. I'm cleaning off the instrument, making sure there's no residue. There we go. Work, doctor. And I am going to offer an explorer just so she can go around the margin of where the band is. Okay. And every time I'm switching instruments, I'm putting the instrument down where I can quickly retrieve it again. I'm trying to keep things as organized as I can on my tray. And she has a little bit of residue there. You're good with that?
Yes, thank you.
Okay, and I'm going to cure. Oops, put it away. Okay. Some of the curing lights have little orange cups around the tips of them, so you won't need the paddle, but you will find these paddles in your operatories. So once that one is filled, then we're going to go right to the 4-2. Okay. And composite.
And do you want to explain why we're not putting flowable into the 4-2?
The 4-2 is a very shallow restoration, and there is no proximal box because it's an incisor. And what she's doing is she's just pressing the material into the prep. And then sometimes what you can do is actually press the mylar against the tooth, which will form the filling. Good, nice, okay.
And we use the paddle end of this composite placing instrument on the anterior surface just for easier pliability of the material.
Okay, so now both of the restorations are done. Normally the removal of the matrices is done by the operator unless they have to run away and do something else. So I will assist with the removal of the matrices. Okay. Good, and now we're going to take off the garrison. Good. So what she's going to do is she's going to remove the wedge, and she's going to move the matrices away from the restoration, and I'm going to come in from the buccal and the lingual to re-cure those areas because you cannot get the light won't go through the matrice because it's metal, unlike the mylar, which is see-through. Okay, and now I'm going to come in with the light and come in buccal and lingual just to give it an extra cure. Okay. And come in lingual. All right. So now our restorations are done. Our doctor's going to check and make sure that everything is cured. And while my doctor's doing that, I am going to switch out our burrs for the polishing. When we're going to be trimming up the composite fillings, we're going to be putting on the little gold shank flame burr, and this is going to get the buccal and lingual just to remove any flash, okay? And then I'm going to put on our polishing disc for my operator for our composite filling. Okay, did you want to check the amalgam restoration?
Yes.
Okay, so let's check the amalgam restoration. Let's do a little bit more carving, and then we can check the contacts. Make sure we didn't glue the teeth together, and we'll start trimming up our composite. So we'll start doing our polishing.
So at this point, I would let my patient know we're almost done. We're just doing our polishing right now, making things look pretty. Okay. Whoop. There we go. Okay, good.
All right, and now she's going to use the polisher, do the anterior.
And you're going to see a variety of polishers. The bird blocks that you have in your operatories are going to be well equipped
With everything you need for these restorations. The other bird that our operator is going to use to take off the bulk composite material is our football gold shank burr, okay? So that's the one she's going to use for contouring the occlusal surface of our composite restoration. Okay, all right. So would you like to check the contacts of those? Perfect. Okay, very good. And we can take off the dental dam together. The forceps is back there. And then all that's left is just to check the bite. And post-op instructions. There you go. Make sure there's no septal dam. Good. Okay, and then we can take that off. Tissue, well done. I'm going to give my patient a rinse right away because they've been in a dental dam. So we want to give them that little freshen up. Good. Okay, and then we're going to just check for any extra septal dam there. Good. And then with our articulating paper, we're going to get our patient to close. Okay, make sure that they can bite. Okay, Manny, we're just going to get you to bite gently. Just tap up and down. Okay, and we're going to take a look. And that actually looks really good. And now with the second motion, we're going to get them to close, and we're going to get them to grind their teeth back and forth. And then we're going to have a look, and if there's any adjustments that need to be made, this is where we're going to make them. Our doctor did such a good job, we don't need to do any occlusal adjustments. So now what I'm going to do is I'm going to sit my patient up, and I'm going to go over some post-op instructions with them. Okay, Manny, we did 3 fillings for you on the lower right. 2 of those were the white composite filling material. Those are set up and those are good to go. You can eat on those right away. However, we did do an amalgam filling on one of the molars in the back. That filling is going to take 24 to 48 hours to set up. Do your chewing on the left side. Nothing hard or crunchy for at least 24 to 48 hours. You will be numb on this side for at least 1 to 2 hours. And if you have some discomfort after the freezing comes out, please call the office.